Hi everyone, just adding Julia. Hi Kate. Your mum's on, Julia.
Is she? She's downstairs.
She's just joined. I saw her little name pop up.
Hi Mum.
How are you doing?
I'm alright, how are you?
Yeah, I'm good, thank you. Been
amazing.
super busy. When everyone else is staying at home, I'm like working hard, but it's all good.
You worker. Mhm. It must be strange going like, because you work in the doctors, don't you? Oh.
Yeah. You right? Oh, you're frozen.
Am I back?
What's happening? You're back.
Am I back?
Oh, you've turned. You're back.
Okay.
You might have to tell your mum to get off the Wi-Fi.
No, my Wi-Fi was off, but now I've put it on.
Ah, okay. So you're keeping busy?
I am, yeah. I'm not sure about like my sister. She's probably watching this, but I'm trying to keep busy. It's hard.
Ali, how's Ali doing?
You know what? It's hard because she's not seeing her boyfriend, so it's hard.
Yeah.
But
yeah,
they're
dead close to them, aren't they?
Yeah, like they literally live together, so it's really strange for them. But we're just kind of dancing every single day. So.
Do you know what's really bizarre? The last time I actually saw you, it must be about 2 months ago, maybe a little bit less, and Alice was there as well, and we all had that chat in the car. Do you remember? And you were saying, "Well, do you know what? It's fine having a boyfriend, having a girlfriend, but you can't be too dependent on them. You can't, you've got to be happy within yourself. Find that love within yourself, and yeah, gosh.
And now it's really showing, isn't it?
Yeah, now you can to see the difference in life. If we become dependent on what we can't see them.
Yeah, I know, like your life changes completely. But like also, when I last saw you, I had tonsillitis, remember?
Yes.
I was dead ill when I had that temperature, and I was like, hello.
Oh, are you now thinking maybe it was COVID?
Well, I know it was tonsillitis now, but it was weird because I had a temperature, but obviously I knew. I went to the doctors and stuff, but
yeah,
that was fun.
Yeah,
that day.
no, but yeah, and I think one of the things we know about coronavirus is, although it can cause so many different symptoms, it doesn't actually tend to cause tonsillitis, like proper tonsillitis. Yeah. You have proper tonsillitis because I saw your tonsils. And they were red, white, grimy, pussy spots on them. Ugh, it was horrible.
I was thinking it was disgusting. That's actually one of the questions. The symptoms.
Okay, yeah. Should we get into it? We should get into it, shouldn't we? Because quite a few people sent questions in.
Yeah, loads of people sent questions in actually, and we tried to like cover them all, like, but we picked out like the main ones, but like the main questions cover all of them.
Okay.
Like the first one is like just like those loads of questions about coronavirus, like the symptoms, the recovery, how long it like takes when you've got it, how does it spread and stuff. So like if you just want to say like an overview,
a bit of an overview. Yeah. So the coronavirus is a type of virus. Coronavirus is a family of viruses, in fact, and some of the members of that family cause the common cold. And in the past 10 years, there have been 3 new strains of coronaviruses that we've come across. So there was SARS, then there was MERS, and now there's this one. And COVID-19 is the name of the illness, the disease that this particular coronavirus causes. And one of its, if you kind of think of it as having superpowers, and one of its superpowers is that it's very contagious, but there are many viruses that are very contagious, like measles, for example, is much, much more contagious than coronavirus. But its real superpower is that it can infect people, and we keep hearing this term, who are asymptomatic. So it can infect a person and be multiplying in their body, which is what it does, and not give that person symptoms, and then be spread by that people to other people. So that's what gives it its superpower, because with MERS and SARS, which were kind of similar in a way, Anybody who got it get on well, and if you get really unwell, then you go home, you go to your bed, don't you, and you don't pass it on to other people, maybe just the people you live with. Whereas with coronavirus, its superpower is that in a lot of people either don't have any symptoms at all, or they have very mild symptoms, and that means that they're potentially spreading it at school, at work, in the supermarket, on the bus, without knowing, because they have no symptoms. And that's the reason why the only way to really stop it spreading is to do what we're all doing and stay at home and socially distance.
I had no idea that, like, I had no idea that you could have it without actually showing any symptoms. But like, how would you know? Because can you get tested?
So you can't get tested currently if you're somebody who's had it and you haven't had symptoms, or you have had only mild symptoms. At some point in the future, probably most people will be offered a test, because the government will want to know exactly who's had it and who hasn't had it. But at the moment, that test isn't available. So that question that the person had about what are the symptoms, well, there's a whole range of symptoms that go. Some people have no symptoms at all, not a thing. Some people, and especially children and young people, tend to have very mild symptoms. So it can be like having a mild cold, like just a bit of a temperature, a bit of a cough, or you know, you hear about this loss of sense of smell, loss of sense of taste. Some people just get like diarrhea or tummy upset. So a lot of people have mild symptoms, and especially young people are much more likely to have mild symptoms. But then as you get towards the older people who have underlying health conditions, they seem to have sort of two phases of the illness. So the first phase is still quite a mild to moderate illness, but some of those people then go on to have the second phase, which tends to be after the first week. So the second week, people who are going to get the real bad breathing difficulties tend to get it in the second week. And then we see a small number of those people go on. I had it, yeah. So I had it about 4 weeks ago. So I'm completely...
Like, what was the first kind of signs?
So for me, and I guess this is only really my unique example of what happened to me. It first started on a Saturday. I was in Manchester seeing my family, and I just felt that morning like I had a bit of a headache and like pain behind my eyes, and that was it. Otherwise I was fine. And my nephew, but what's weird is, and I don't know if this is because I'm a doctor or because it's intuitive, but when I met up with my dad and my nephew and my brother and my brother's girlfriend, I was like, do you know what? Don't hug me. I'm not going to touch you, because I've got a bit of a headache. I feel a bit unwell. It's probably nothing. And my dad was like, don't be silly. Come here, give us a hug. I was like, no, seriously, don't touch me. Don't touch me. And I don't know, it was weird. Like, I knew. Anyway, later that afternoon, I played football with my nephew for a bit, and just was more out of breath than usual. Just felt really tired after about half an hour. About an hour after that, I was sort of slumped at the table, being like, I'm so tired, I need to go home.
Really?
Got home. That's when the fever started. Didn't have a cough. I spent 2 days in bed, just like muscle aches, but just so fatigued, just so tired. And then after those 2 days, I was kind of all right, but it took me about 2 weeks to get, you know, I'm like you, I like to exercise every day if I can, but it took me about 2 weeks before I felt I had the energy to exercise again. So for me, it wasn't a bad illness. I've had worse tonsillitis for those 2 to 3 days, but it came on so quickly, and it took such a long time to fully get better. But, you know, it wasn't well.
Yeah, were we in lockdown when you had it or not?
No, it was before lockdown. So it was when the advice was to self-isolate if you have symptoms. So from that Saturday, I self-isolated for a week, and then it was on the Monday that lockdown happened. So I've actually been sort of doing this staying at home thing for a week longer than most people.
Well, yeah, you get on with it, don't you? That's actually the next question, actually, because it was this question was asked like so many times. Like, it was the most popular question, and it was when will it be over? Because they said at first, they were like, firstly we'll do 3 weeks and then see how it is, but now the 3 weeks is up, and I think people like don't know when it's going to end, and that makes it hard.
It's really hard, and I think that's probably something that younger people find even harder than us old folk is, you know, it's fine, but we just need to know when it's going to end so we can plan. And obviously people who've had their exams cancelled and school closed, it's that not knowing when it's going to end, isn't it, is really difficult. Unfortunately, as you know, I don't have the answer, but when the lockdown happened, we were told that it would be reviewed in 3 weeks, and that 3 weeks was Monday, yesterday. So this week, the scientists who advise the government are actually in meetings all week to determine what the next step's going to be. And I think it's Thursday that they're going to announce what the next steps are. Now, I don't know for certain, but I'll be honest, I think it's definitely not going to be the case that on Thursday they'll say, boom, done, everyone back to normal. That's definitely not going to happen. I don't think anyone expects that'll happen. The question is whether there'll be any changes.
Yeah, but I think like if they just give us an update, it gives like we can work towards something. So when they had 3 weeks, especially because my sister, like, she hasn't seen her boyfriend, she had it in her calendar. She like counts down, and it gives you a focus, like we've got this day and then we're out kind of thing. So I think if we like just know, it just helps, like especially people's mental health. It can help if they just know.
Yeah. I think what we'll hear on Thursday, my guess is, I don't think it's going to be great news, in that I think they're going to ask us probably to stick with what we're doing for a little bit longer, because we're just starting to see the effects of that. It takes 3 weeks for us to see the effect on the rates of people dying, because it actually takes 3 weeks for somebody getting the infection to, if they are sadly going to be one of those people that gets really unwell eventually and passes away, that whole process takes 3 weeks. So because we're sort of starting to see some change, it's still, you know, it looks like the social distancing really has worked, and I think over the next week we'll hopefully start to see more of that. I'm guessing that they may say we need to do it for another 3 weeks. I'm a complete guess. It's a complete guess. But if I'm honest, I think they may say, look, you know, everybody's done a fantastic job, and now we are saving lives by staying at home. We are genuinely saving lots and lots and lots of lives.
So it is working.
It is working, but we're just starting to see the benefit. So I think they're probably going to say that we need to, I think they'll still give us that weekly thing. It might be that we need to do it for another 2 weeks in review. We need to do it for another 3 weeks in review. But I think it'll be quite several months before we're fully back to normal. If not, well, I think might be it's more like months than weeks that will be completely back to normal. But that's not to say that certain things like schools might be one of the things they do first. That's not to say that schools won't be reopening much sooner than, say, for example, elderly people going to the supermarket if they have lots of health problems.
So you think this Thursday, that's when they're...
I think on this Thursday is when we'll get the update, when we'll find out what the...
So everyone will ask that question, because so many people ask that question. Thursday.
Yeah, so tune into that government briefing on Thursday, and I don't know who will be delivering that message, but I think everybody around the country will be on tenterhooks waiting for that briefing, just to see what's next. And I would say, brace yourselves though for this current measures to need to continue a little bit longer.
Yeah, but I guess like if it's working, then it's so worth it.
Exactly. Have you found it yourself? How have you found it, Julia?
It's weird because I'm so active. I danced every single day in college, so now I've got nothing to do. So if I don't have a routine, this is actually one of the questions, like how to keep busy. And obviously, because I'm everyone's age, I'm a teenager. So if I don't have a routine, I get quite down. I get really sluggish. And I think because teenagers, we go to school, we have a routine every single day. So I've set myself a morning routine, and I get up, and I'm trying new things as well. So I started meditating. Never done it before, but it's quite hard, but it's working. And I've started reading. And I've got like a morning routine going, so that like it kind of keeps me sane. And I really recommend having even like a night routine if you really don't want to wake up in the morning, just some sort of routine, because that's what we had. We went to school, So having like a routine, like kind of keeps it, really helps pretty much.
I think it's really good advice for younger people, but for us as well. Like,
Oh, yeah.
I mean, very lucky that my job, I still get to do my job, but I
Yeah.
know a lot of my friends. One of my friends, Kirsty, she lives in LA, she lives in Los Angeles, and she's working from home. But I admire her because she gets up at 7 every morning. She gets in the shower, she has the same breakfast, she does her 10 little minutes of meditation. And that's just, it's incredible. But like you said, the benefits of just having that bit of routine can be really helpful. And lying in bed, as much as I love to have a lie-in, and
Yeah.
teenagers all love to have a lie-in, and that's not because teenagers are lazy, that's actually because your brain's biology tells you
it.
to have a lie-in.
Yeah.
But sometimes lying in too much can actually give you a bit of a dip in your mental health as well. So even if it's like saying, right, well, 11 o'clock, I'll never stay in bed longer than 11 o'clock. And, you know, you might get up early, having a cut-off at which that's the absolute latest I'll stay in bed might be helpful.
Just have like a goal even, because at first, I'm not gonna lie, I stayed in bed the first week of lockdown, and then the second week I was like, I need to get a routine, otherwise I'm gonna go insane. So I started it, and I get up like 8:30. I get up and I start my routine. And on the weekends I don't do that. I lie in, and actually on this weekend just gone, when I lay in and I got on with my day, like the day was gone like that, which I hate because time goes too quick. And I just felt so sluggish all day, and I feel so much like happier when I get up and I have my little routine. It just really can help, so I recommend it.
I think even if, because say for example you're watching something on Netflix at night, and you know that, you know, because sometimes I think you lie in bed, don't you? You think, I know I should get up, I know I should get up, but there isn't that thing that you go to school, you don't have to be anywhere. So even if you sort of make, like you said, just set that goal that I will be up by 10 o'clock, and the first 20 minutes I'm just going to watch the next 20 minutes of the episode of whatever, like even if you're just up and out of bed, even if that's just to sit in front of the TV with a cup of tea or whatever, at least you've made that, you've done something, you've got your first success of the day, and
exactly.
that's going to
Start your
get you
day right.
bed.
Yeah, and you can just do it. Like, you don't have to do it every single day, because I think while we're on lockdown, it is good to like chill out and do whatever you want, because we never really get the time to do that as teenagers because of school, obviously, and like outside activities. So it is really good to like relax. But like if you are struggling with boredom and even like mental health, I think like definitely just at least one day just get up and like kind of get a little routine going.
Do you know what it'll help with as well? Because I just saw somebody on the comments there. It will help with sleep as well, because teenagers just have a different clock, a different sleep way there, that teenagers are expected to get up and be at school by 9 o'clock.
Yeah.
Your body clock tells you to stay late and get up late. But people who are struggling with sleeping, if you get up early and you go either outdoors or spend some time at a window, especially if you've got a window where the sunlight can come in, if your brain recognizes daytime by seeing the blue light, the natural light that comes from the sky, then by 12 hours after that, your brain automatically thinks, well, it's been 12 hours since I saw that daylight, so it must be time to start winding down and getting ready for bed. And there's a hormone called melatonin that your brain releases that tells you to feel sleepy. So actually getting up early in the morning, even if you then have a nap in the afternoon, but giving your body that flood of natural light early in the morning will help you sleep better at night as well.
Whoa, I did not know that.
There you go.
So open your curtains when you wake up. Open your curtains. Look out the window. Yeah.
Exactly. Yeah.
And make your bed. Make your bed. Because I make a bed. Make it all nice, and you just feel better.
You know how in the army, in the military, like they're really strict about the beds have to be made perfectly. The first thing that you do in the army, you get up, you have to make your bed. It has to be perfect. And one of the reasons they do that is because it means even just 10 minutes out of getting out of bed, you've already succeeded in achieving something before you even move on to anything else. So by making your bed, you can think, right, do you know what? That's one win down. If I don't do anything else today that's productive or helpful, then I've done that one thing. So you're already successful.
Yeah, because like a lot of people are concerned about like mental health and they're really anxious. Obviously, like they don't want to go outside, or also like their family like members have got coronavirus. So a lot of people are struggling with mental health, and also because when you're like inside all day, it can affect your mental health, can't it? Like especially like you can't see your friends and stuff as well. So do you
Yeah.
have any like advice on what to do?
I think it must be for people your age, and I know obviously with your sister as well. I think not being able to see your friends and see your boyfriend,
Yeah.
girlfriend if you have one, I think that must be huge. And I'm trying to think back to when I was a teenager, which is a long time ago, but I remember like seeing your friends was the most important thing. It was the best.
Yeah.
The best thing about life would be seeing your friends. So I can get it.
Yeah.
It must be so hard. And I guess there is that benefit now that you guys have Skype and FaceTime and House
Yeah.
Party and Zoom, so at least you can see them remotely. Whereas
Yeah.
I'm so old to do that when I was your age. Anyway,
You're not. You're like 20. It's fine.
I wish. Um, so I guess that's the main tip: is staying connected is really important, and I think
Yeah.
sometimes what we know is that when people are struggling with their mental health, whether that is feeling low in mood or feeling anxious, then one of the things you might be less likely to do is actually reach out and call a friend or Skype a relative, or
Yeah.
check in with friends and actually engage with them. And that can create a bit of a downward spiral, like because you feel a bit low, you think, oh, I'm not going to reach out to Julia and have a chat with her today because I feel I can't really be bothered, my motivation's not there. And then because you haven't had that contact with that person, you can feel lower and so on. So
Yeah.
sometimes it might be worth scheduling in chats or saying
Yeah.
with you and like your friendship group, I don't know, at 7 o'clock every night, we'll have our 20-minute house party. Or so it's and then people, if you don't attend, and your friends will be like, oh, what happened to you? Why weren't you there? And they're going to check in with you. So making sure that you have scheduled check-ins with friends.
Yeah. It's like on with my Mersey girls with our
Mm.
little Zoom. Actually, Zoom is really good. You had a party on Zoom and it was so good.
I'm sorry
But
about that, by the way. Your young teenage ears should not have seen or heard when you saw that.
no, it was a ball. It was great. Zoom. If you don't have Zoom, you should get Zoom because you can schedule meetings. Because on House Party, like we went all live together on House Party, but like anyone could join. But with Zoom, it was like private, so it was just us. And every Saturday at 8, we do a quiz, and we all do a round each, 10 questions, and it's just so fun. And it's actually quite sad when we're saying bye to each other, but it
Oh,
just you feel like you're with them for that hour where
yeah.
you're on FaceTime. You feel like you're with them. It's like normality.
Yeah. And for people on House Party as well, you've got to lock the room. You can, once you've got everyone in, you can lock the, if
You
there's
can
a thing at the bottom, to lock the room so nobody can come in. Because it
I was
is a
gonna
bit
say,
dodgy, that part of
yeah, we were live, and then this random guy came on, and I was like,
it. Get out! You're not invited.
yeah, yeah,
I
it was
think,
not cool.
going back to mental health, it's such a
Yeah,
big one at the moment. And I think, for young people, one of the really good bits of news is that this virus, luckily, doesn't really affect young people that badly. It doesn't seem
yeah,
to make young people unwell. Of course, there'll always be the odd one exception, but actually, this isn't a virus that's dangerous for young people. But the mental health effects of what we all have to do in order to protect everybody else from the virus will affect young people, and I think things like anxiety and low mood, and even things like people do have eating disorders, then things like that may get worse because it might be
yeah,
linked to their anxiety. So I think it's the first thing is being able to talk about it, and if you can't talk
yeah,
to your family about it, then talking to friends about it. If you can't talk to friends about it, then going onto Childline, and there's a charity called The Mix that looks after young people's mental health, so that's for people under the age of 25. And what else? I think I wrote some things down. Oh, NSPCC and Save Lives. But I think young people are really savvy at finding information that they need online. And I think if your
yeah.
mental health is starting to suffer, don't wait till it gets really bad. Seek help sooner rather than later. And you mentioned meditation.
Yeah,
It's hard, isn't it?
honestly, it's hard. When I first tried it, I just kept getting really distracted, and it was really hard. But I just stuck with it, and I only do like 5 to 10 minutes in the morning. But it's the first thing I do because I used to check my phone and scroll through Instagram every morning. But now, oh, Katie said Young Mind is good.
Oh yeah, yeah, that's another great one.
Um,
Youngmind.org.uk, I think.
Yeah, but anyway, the first thing I do, I get my phone and it's a guided meditation because I can't do it on my own yet because I just get too distracted. So I put my headphones in, and then when I get up, I just feel so much better, and I just feel really light and like positive, and it stays with me through the day. And you can like also like do it anytime in the day, and we're all home. We're literally all at home, so you can do it whenever you want.
I think it's the same. It's the same with me. I'm of all the healthy practices when it comes to lifestyle, like eating healthy, being active, my sleep's fairly good. Meditation's the one I found it really difficult over the years to find meditation that works for me. And I'm the same as you. I find the guided meditation much better. And about 10 minutes is, I do a bit more sometimes now, but I think 10 minutes or even 5 minutes, if you can do it, it's enough.
Yeah,
But what I also find, I'm a bit naughty when I meditate. I'm not naughty because it's not intentional. But when I'm trying to just sort of relax and, you know, stop all that busy traffic and let it calm down, that's when I tend to come up with my best ideas. So it's
really.
something come to me really clear. And I think I have to break it and write it down because I think I'm going to forget.
No,
But
that's great. That's a good thing.
yeah, what meditation do you use an app for your guided meditation?
No, YouTube. I just go on
Okay.
YouTube, guided meditation, and because I just do short ones. There's literally so many, and you'll find like different ones you like, and also something that helps me through the day. Because I like visioning. I don't know if you know what that is, but it helps because while we can't do anything, we're at home. There's guided like visioning things. So I put my headphones in and I pretend I'm like, I don't know, with Mersey Girls dancing on stage, and you actually think you're there, and you get taken away, and then it ends. You're like, oh, I'm at home. So that can actually, it actually makes you feel like you're with your friends. You're doing the things you love still. So that's actually a really good thing as well.
Yeah, and there's probably science behind that because if your brain recognizes that as you having spent time with your friends, then you may actually get some of the benefits of it. There are a couple of apps that I've used. So Headspace, I think is, have you heard of
Yeah,
Headspace? Yeah,
I've
so that's a
heard of it,
free
but I
one.
haven't.
And then there's one called Be Mindful as well. So, and that, you know, they tend to be free unless you really, really, really like them, and then they can sometimes start to charge you like a couple of pounds a month or something. But they tend to be
Does
free if you just with the 10-minute ones.
does meditation actually help with, like, can it help with mental health?
Yeah, definitely. Lots of evidence to say that meditation can help with mental health. And reduces stress, can reduce anxiety, can lift your mood, can help with
Yeah.
sleep. There was someone saying there that they listen to meditation to help them
Yeah.
sleep. It's telling us that Calm, there's another one called Calm. Yes, there is. So yeah, there's a lot of emerging evidence around stress management because we live in a world now where I mean, if you go back 100 years, the things that caused poor health and certainly the things that killed people, a bit like right now, were infections and
Yeah.
traumatic accidents and things that required surgery like appendicitis. Whereas apart from this pandemic that we're in with this virus that is obviously terrible, mostly we are quite good at managing infections now. And the thing generally that causes more poor health than anything else is stressful lives. And if we're stressed, we're less likely to eat well, we're less likely to exercise, we're less likely to sleep well. The one thing, if we can do one thing to improve our health pretty much across the board, it's anything that reduces stress. Exercise is a
Yeah.
great stress reliever, as you know, but
Yeah.
meditation is well, and it can be done, as you say, in as little as 5 minutes. 5 minutes every day to meditate can really help people.
Yeah, and you just like, because everyone's so busy, like even if we're not busy right now because we're at home, but like in your head, like all these thoughts going around, and like when you meditate, you just breathe in, and you do just like forget, and it's just quiet, and it's really good. And like you said, exercise, even if you're like not a dancer, there's dance online classes, which I love because no one can watch you. So if you mess up or you don't think you look very good, it literally doesn't matter because no one's watching you. So I definitely would recommend them.
You would have laughed at me earlier. So this morning I did an online, that was a Zoom Zumba class. And when it was all the sort of Latino ones, I was like, all right, yeah, I've got this. And then he did like a back out one. And I was looking at myself in the mirror. I was like, it's terrible.
No, I bet you're amazing. You can do flips.
Well, yeah, that doesn't mean I can dance though.
No, but like it
Dr.
doesn't
Zoe
matter.
Strictly 2021. I need to start
There you
campaign.
go. I know, but the thing is, like, because no, it doesn't matter like how bad you look, because like there's no one around you watching
Exactly.
you. So you can
Exactly. It doesn't matter.
Mm-hmm.
And you know, I was dancing and I had the biggest, whenever I caught myself in the mirror, I had like the biggest smile on my face.
Yeah.
So yeah, dancing's amazing, isn't it?
Yeah, it's amazing. And also what me and my family did once was we just put on music and we just danced around the living room for like half an hour to our favourite songs. And you can literally do that on your own in your room. It's the best thing ever.
Yes, definitely.
Recommend. And karaoke. I love karaoke. I've been doing some karaoke.
But again, it's not fair because you can dance and you can sing. So when you do both of those things, you're doing them well.
Well, thank you very much. But so can you also, someone asked, I think it's Amber, she said, is there a best time for meditation?
Not necessarily. I think the best time for meditation is the time at which you're most likely to do it. If you were to say, well, do you know, actually, for me, it makes no difference any time of the day, then probably the morning, because like you said, you get the benefit then for the rest of the day. It can really help calm your mind. But generally, it doesn't really matter whenever people can.
That's fair enough. Do you know what I think's really, really cool? Like, obviously nothing's cool about coronavirus, but like how, you know, every Thursday, is it Thursday at 8, we clap for the NHS, and which I love. And everyone on the street is out, and my friend's like, she bakes cakes for her neighbours, and like kind of everyone's kind of come together kind of thing. And someone was asking, there was like quite a few people asking, is there anything they can do to like help the community? Because obviously they can't see people, but like, is there anything that they can do?
I think there's a lot that people can do. And young people, you know, if people are under the age of 18, then the NHS volunteers that I think 1 million people have now signed up to support. I think a lot of the time, like certainly in hospitals, you have to be 18, but it's worth getting in touch with the local NHS volunteers. But there's loads of other things you can do as well. There's lots of local charities that will allow young people to help them. So I've written a couple down here in preparation, actually. You can find out about local food banks. So at this time, lots of food banks are really busy and they're not necessarily being funded as well as they normally are. So seeing if you can help out your local food bank. There's a charity called Step Up to Serve that you can search for as well if people want to do that online. Thinking about, scientifically, we know that giving and helping others is really good for our mental health. So it's something that I'd really recommend young people get involved in. And it doesn't necessarily need to be as formal as volunteering. It could be, I don't know, having a clear out of all your clothes and seeing what you don't want anymore and giving what you don't need to a local refuge. It could be doing some baking and, you know, doing some baking for your family. If you've got younger children in your family, saying to mum or dad, you know what, I'll take the day off. I'm going to teach them today. I'm going to teach them some stuff they actually need to know in life. I'm going to teach them life sciences. And then one other thing, even you could link it to exercise. So going for a run, running 5k and then donating £5 to charity. So at Run for Heroes online. So there are things like that you can do as well.
Wow, I didn't know that. Like when you give, it can help your mental health.
Yeah, definitely. So when we talk about the needs that a human being has to be healthy, right at the bottom, like the biggest, most important thing is having enough food to eat, having enough water to drink, and having shelter. Then next above that is about feeling safe. And then above that, before you get to things about like eating really healthy food and exercising, etc., one thing that comes before that is having purpose, and feeling that you're important and feeling that you're you know, doing something to help others.
Good. Yeah.
And volunteering, whether it's formally for a volunteering service or whether it's just doing kind things for people in your house, or it might even be if you've got elderly relatives, even if you think, oh, do you know what, it's really boring speaking to that person, but just giving them a ring or writing them a letter, because I
Yeah,
guess it's
I
something
did love that. Yeah.
writing letters is quite cool, isn't it? Because it's
Yeah.
something you perhaps don't do that often, but writing letters to people, you can still send letters to people. So anything like that makes you feel good, because you haven't done that for you, you've done it for somebody else, but actually in return it is good for your
You
mental
feel
health.
good about yourself. That's so
Yeah.
cool. So there's quite a lot of things that you can still do.
Loads of things you can do. And I think as well, I went to Wilko's earlier, Wilkinson store, because me and my boyfriend moved into this place just before we both got unwell, just over a month ago. So we've literally been, this is a new mug, we've been sharing one mug for the last month, like taking turns to have a cup of tea. So so I went to Wilco and bought some stuff, and I was quite surprised. The area that was quite busy in Wilkinson's was the gardening area was really busy, but also the home decorating, like, and tons of paint and stuff and brushes, they're not that expensive. So asking your parents if you can decorate your room, I mean, it's probably some parents going to get in touch with me now and be like,
Sorry.
but asking if you can decorate the room, or even do some decorating for them that they want to do, whether it's a bit of painting or whatever.
There's always a fence that needs painting. We go on a walk every single day, and there's these kids who like paint their fence. And also I really want to paint our fence. And it's funny you mentioned that, because we've just ordered, they came yesterday, gardening gloves and like all gardening stuff, because we're gonna do our. And
people could go around and paint their fence like a rainbow for the NHS. How nice would that be?
My mum actually said that I should paint a rainbow in our shed outside. And this is all stuff that we've ordered lights for our garden as well. And this is all stuff that we never would have done if we went in lockdown.
Yeah. Oh,
we can keep
yes. I think there's lot. Can I ask you? There's a question come up a couple of times about people with asthma. I'll just answer that, because so we keep saying sort of younger people don't seem to be affected that much by coronavirus. If they get it, they might not have any symptoms, or they might have very mild symptoms. And what we've seen so far is that really is the same even for children or young people with asthma. We haven't seen a lot of young people at all need medical support, need hospital, certainly need intensive care. Of course, there'll always be one or two with anything. So far, even people with asthma, if people use maybe a purple inhaler or a brown inhaler and a blue inhaler, that sort of level of asthma, it's good news that we still, you know, those people shouldn't be scared or be worried. Obviously, avoid getting it, but shouldn't be too scared or worried. But people with asthma should still be a little bit more cautious, obviously, because, you know, we're still learning about this. And although we haven't seen that picture develop so far, we still should be very cautious. There's this group of people who have to shield for 12 weeks, and sometimes children might be included in that, and young people if they have very severe asthma. So that would be people who've had to be admitted to hospital because of their asthma, or perhaps people who need to take very strong tablets that reduce their immune systems. It's a very small number of people who have asthma so badly that they would be on that list. They have to be extremely careful. Again, it's not because we've seen those people having real difficulties, but it's just that we will guess that if they did get the more severe case of the illness, they might find it more difficult to manage it. So just for those people asking there who are asthmatic, if you're somebody who has asthma that's just uses inhalers and you've never had to be admitted to hospital, then don't be worried. We're not seeing those people have terrible consequences, but, you know, obviously use your inhalers properly and social distance, but don't be worried, essentially.
So just like follow the rules and it should be okay.
Yeah, and I think that is really important. It's really hard. I get it. It's really hard for young people, like the temptation to meet up with friends and stuff. It must be so hard, but it is true that even just meeting up with one person who you wouldn't have met up with otherwise, even if you have no symptoms, there's a risk you could give the virus to them. They might not have any symptoms, but they might give it to their mum. Their mum might be a carer, might visit somebody who's elderly, and it can come back to trace back to you, to think that if you haven't, you probably never know about it, but if you did, you found out, if I hadn't have met up with that person, then that might not have happened. So we just can't take any chances.
So how does it exactly spread? Because I know, like, me and my sister, we do the shopping for the house because my mum's still at work, and because she works from home, so we go shopping, and when we go in the shops, they obviously queue 2 meters apart, and then we have to spray like the trolley with antiseptic stuff, and like they have antibacteria stuff for your hands. So does that, and then we like touch all the trolleys, but because we've put that on, does that mean it won't be on there? Like, how does it spread?
Yeah, so the virus spreads through what we call, scientific term, respiratory droplets. So what that means is, if you cough or sneeze or, I don't know, lick your hand, all the tiny, tiny millions of little virus particles, if you have it, will be in that liquid. So those droplets are from sneezing, from coughing, from licking. And those little droplets, those like water droplets, if they either are coughed into your face and then they land and touch your eyes, your ears, or your, I was going to say, not ears, your eyes, your nose, or your mouth, not ears, then you can catch the virus. Or if those respiratory droplets land on a surface and then somebody else touches the surface and then touches their own eyes, nose, or mouth, then they can get it. So essentially, there are 2 ways you can catch this. Either if you're close enough for somebody that if they coughed or sneezed, which if they're coughing, they should be at home anyway, they shouldn't be out, but for example. So the idea is, if you're 2 meters away, then it's unlikely that that cough or sneeze is going to get far enough before the little droplets drop to the floor. Although there's some evidence to say that actually you may need to be much further than 2 meters away, but it's not possible necessarily to say 8 meters away all the time. So that's why it's 2 meters. And then everything you touch, if it's something like a supermarket trolley, then you almost have to assume that somebody who's infected may well have coughed on their hand and then touched it. They might have coughed directly onto it. So those droplets and that virus on the surface can survive for 3 days. Sometimes, depending on the surface, up to 3 days. So you almost have to assume that every surface you touch that somebody else has touched has the virus on it. But if you use the alcohol gel on your hands and a bit on the trolley, then that denatures the virus. The virus is still there, but it can't infect you anymore because you've weakened it, you've kind of killed it. So that's why washing hands in alcohol gel, as much as it's so monotonous about the washing your hands, like genuinely, regularly washing your hands is the single most effective thing you can do to protect yourself from getting this virus.
Yeah, we also wear gloves and then put them in the wash when we go out.
Right, yeah. So you have to be careful with gloves. That's if you put the gloves on and then you don't touch your face at all, ever, with the gloves on, and then as soon as you come in, you put them wherever to decontaminate, then that's probably giving you a little bit of protection. But if you were to film yourself for that half an hour or whatever, I bet you do. I bet you do. I mean, I was doing very early on in this. I was at This Morning, and myself and Dr. Sarah did a little Instagram live on my Instagram, and we were talking about washing your hands, not touching your face. And I think both of us must have touched in the 15-minute long. I think both of us touched our face about 3 or 4 times. It's so.
Yeah, well, I bite my nails. Well, I used to bite my nails and I can't now. So now they've grown really long. But I do like just find myself like that, and I'm like, stop.
Yeah, I know. Well, it's a good opportunity to try and break that habit, isn't it?
Yeah, it is. It's helped. It has helped a lot. Also, someone said, I think you answered it at the start, but I'm not sure if they were here. They said, after it's over, will everyone get tested?
So I don't know if everybody will, but the testing, I'll explain it quickly, the testing. So there are 2 different types of tests. The first test is a test that detects the actual virus. So that's a test that would be positive if you actually had it and had symptoms, and that's a swab test. They swab your inside your nose and the back of the throat, and when they analyse that test, they're actually looking to see the virus itself or part of the virus itself. The other test, which we haven't got yet, the antibody tests, what that is looking at, that's looking to see if your immune system has had a reaction to coronavirus. So if you've had it at any point, even if it was a month ago, then you'd expect to see a positive test. So these are the tests we don't have yet, and these are the tests that potentially lots of people may be able to buy in Boots or buy on Amazon and do the testing themselves. And it will be in the government's interest for as many people as possible to have that test done, because it's not until we're able to test all the people who haven't had symptoms or who've had very mild symptoms as well that we'll know realistically what percentage of the population have actually had it. And when we are able to do that, and we do that testing and we get the results, the higher that number is, the better. So say that came back, for example, it won't be, but it was 50%. There was a study done at Oxford University that suggested it could be such. That would be really good news, because that would mean half of us are now have immunity.
Yeah.
But if it came back and it was 2%, it'd be like, oh gosh, because that means when we do all go back out into the normal world, if it comes back, or if we haven't managed to get rid of it enough, then we could see the numbers starting to rise again. So at some point, I think tests will be available, but not for a little while.
Oh, that's good then, because I lost my sense of smell and taste, and my sense of smell, it's like kind of come back, but it still hasn't, and it's been like 3 weeks.
Oh, there you go. Yeah, you're back.
Are you froze?
So you might have had it then, Julia. There's a chance.
But then, if I got that test after, then it could tell me if I had it.
Exactly. Yeah. So the only way you'll know whether that was it is if you have a test that confirms it. Because of course there are other things that could affect your sense of smell as well. So lots of other viruses, like even just like a normal cold could. This time of year, some people are affected by hay fever, and that can affect it. But it is a bit unusual that so many people have reported just this symptom of a loss of sense of smell, and that doesn't happen normally. So it's possible, but yeah, unfortunately the thing is, like, even I haven't had a proper Public Health England approved test yet. So I think I've had it because it was such an unusual illness, and all of the, you know, I think I know where I got it from, and then my boyfriend got it 5 days after me, so it all fits. And also there were some prototype tests that I used, one of the prototype antibody tests, and we don't know how accurate they are, but it gave me a positive result. So that combined with the symptoms, I'm fairly confident I've had it, but I don't know for certain, which means that if I was to get a cough tomorrow, I would need to self-isolate again for 7 days, because I just don't know for certain that I've had it. And it was possible that was something else. So we all need to keep self-isolating for 7 days every time we get a cough or a fever, until the advice changes, or we've had a test. And actually at the moment, even if you've had a test that says you've had it, you still need to self-isolate for 7 days, because that is the standard advice. We don't know if you can get it again.
Yeah. Oh, really?
Yeah.
Also, you know, if someone asked if you should self-isolate from the family that you live with, like, because if they're going to the shops, like, should they self-isolate from that person?
So if anybody, the rules are, if, say for example, you were to get symptoms, then you have to self-isolate for 7 days, longer if you still have a fever. So that's you. Then your family members, they have to self-isolate with you for 14 days if they don't get symptoms. If they don't get any symptoms after 14 days, then they don't need to self-isolate anymore. So that means that the whole family can't even go to the shops. That means you need to get food delivery, or you need to get a neighbour, or you need to get someone to help. So one member of the family gets symptoms, the whole household loses that ability to go for essentials, to go out for daily exercise. You all have to stay indoors. Obviously if you need emergency medical treatment or something like that, then you can break it. Now let's imagine what happens to the rest of the family. So you've got symptoms day one, you have to self-isolate for 7 days, your family have to self-isolate for 14 days. say your sister on day 3 gets symptoms, well, she then has to self-isolate for 7 days. So she actually shortens her period a little bit. So as long as her fever's gone, so she will
But
have
then
9 days.
if she would, like, the 14 days of the other people have to start again?
No. So,
No.
so for everybody else, they still stick with 14 days from when you first got symptoms.
Okay.
Now, say on day 14, say on day 12, your mum gets symptoms, she then has to do another 7 days. So that means she would do 19 days total. But say another member of your household never gets symptoms, they'd do 14. So you'd do 7. If anybody else gets it within the first 7 days, then they shorten their period because they just do 7. If anybody else gets it in the second week, they have to do a longer period because they have to do 7 days when they got it. But for the people who never get symptoms, then that day 1 is when you get it and they can go out after 14 days. It's quite complicated, isn't it?
Yeah, so it's like the person with the symptoms only has to self-isolate for 7 days, but the family has to do it for 14.
Yeah, and that's because the incubation period, so the incubation period is the period from when you get the infection to when you first show symptoms. That period can be anything from 2 days to 14 days. So on average, for most people, it's about 5 days. So what you'd expect is if you've got it, you wouldn't have symptoms for the first 5 days. Then you start with symptoms. You and your whole family would self-isolate. Because you're now coughing, you're like to spread that to your family members. So about 5 days later, they would get symptoms. But in some people, it can be 14 days before they develop symptoms. So the idea is, if they're going to get it from you, they're going to get symptoms within the 14 days. If they get to 14 days, they haven't got symptoms, they've probably either had it with no symptoms or they're just not going to get it.
All right. Also, I don't know if you see the comment of dance_dad_Alex asking a question. Can you see it?
I can't see that, no. Oh, hang on. Oh, hang on. Maybe I can. Ah.
You want me to read it to you?
Yes, go for it.
Can you ask her if the reports of secondary infection despite positive immunity tests in other countries are correct?
Read that again.
Can you ask her if the reports of secondary infection despite positive immunity tests in other countries are correct?
Okay, so I'm not sure I can fully answer this one, but secondary infection, what we know about this virus is there are 2 phases to the illness. The first phase is kind of like the viral phase, and that's your body is responding to this virus. You get a fever, you have a cough. This virus is replicating really quickly in your lungs. Most people after 7 days get better, but some people go on to have this second phase of the illness. And if somebody's going to require admission to hospital, it tends to be on average about day 10, which is exactly what we saw with Boris Johnson. It was day 10 that his breathing got quite bad. And the thinking at the moment is that that phase of the illness, it's not necessarily the virus that's making you unwell anymore. It's your own body's immune system that has kind of almost overreacted to the virus and is now attacking your lungs, the cells where the virus was. The virus is gone, your body's fought it off, but your immune system is now attacking the lungs. And that's why people get this viral pneumonia, where you essentially get lots of leaky fluid in the lungs. The lungs become quite wet and it gets very difficult to breathe. Secondary infection can happen. So secondary infection would be when you get a bacterial infection, so you get a chest infection on top of the virus. I don't know about other countries, but I know that in this country, at first we were treating lots of people with antibiotics as soon as they got that pneumonia phase. But actually what we're seeing is that secondary bacterial infection is quite rare. We're not seeing that so commonly at all.
Right.
Hope
So there you
that
go.
answers this question. It's very scientific.
There's
I don't
actually
think he was a teenager, do you?
no, but I think he's got a child.
Ah, okay.
That I know. But yeah, because that was quite a complicated question. But there's one more question which I actually really want to know. They said that when you were on live, you mentioned something about like you can tell when people go out and for how long and how many times a day. But then they said that they hadn't heard about it since, so they wanted to know what it was.
Yes. So yes, I know what you're talking about here. So the government have got a general idea how often we are all leaving our homes, not necessarily individual people, but at population level, they know that on average, before all this happened, the typical person would leave their house 3 times a day. And at the moment, the typical person is leaving their house just once a day. So that's how they're so confident that people are abiding by the rules and doing their best. And, you know, people have really made huge changes. And the reason they know that is because they track our devices, mobile phones.
You're lying.
Yeah, no, I'm not. So they're, you know, they're not going to use this to come and knock on your door and say on Saturday the 4th of April, you left your house 4 times. Like, what was that all about? That's not what it's for. So it's just so that they have a general idea, and this isn't to, you know, speculate on any particular group and what they're doing. But they might use that to compare things like London to Manchester or Wales to Scotland. But yeah, so they somehow they have access to signals, which isn't surprising really, because I mean, I could take your phone off you for 2 minutes and know exactly where you've been over the past 6 months. So it's not surprising that the government can track from Google Maps or whatever. But yeah, that's how they know.
Wow. So because I went to the shops today and then I forgot to get Marge, and we have no Marge, so then I had to go back to the shops to get it. So that's like, they can see that.
I don't. If they really wanted to investigate you for some reason, then they could. But you know, they're not. They wouldn't. They're not necessarily looking at it in that much detail. But you know, they could come knocking up. They won't, and they wouldn't. But you know, essentially, they could come knocking on your door and they could ask you, was that second trip for margarine really necessary? Could you have made do without it until your next big shop? And you know, you'd have to answer. And I think it raises a really interesting point about, we have these government rules that we've all been set. We can only leave our home for 4 reasons, but there's not a great deal of detail added to them, and lots of people will interpret them differently. So leaving your house once a day for exercise, some people will think, right, I'm going to put my trainers on, I'm going to go for a jog for half an hour, avoid people and come straight home. Some people will think, I'm going to go on a bike ride all afternoon and stop on several occasions and eat my sandwiches by the lake. And you know, and it's clear to see that one is okay and one isn't. But what about all the stuff that's somewhere in between? And everyone will interpret it differently. So leaving your house only for essential supplies, some people will be like, right, I'm going to the supermarket once a week, I'm going to get my rucksack and I'm going to get everything. And some people will be like, oh, I'm just going to pop in every day and get, you know, what I want for dinner that day. And you know, I think generally, if people have to do their best to reduce their contact with other people as much as possible, and recognise that we're all going to interpret it differently, but we just need to do the best that we can.
Yeah, but if people weren't here at the start, is it Thursday? They were going to hear more.
Yeah, so we're expecting that on Thursday, the government press conference, that's when we'll find out what the latest is in terms of the social distancing measures and whether anything's going to change. And I anticipate it won't change, and that they'll probably say to us it'll be reviewed again in another 2 weeks or 3 weeks.
At least then we know.
Exactly. At least we know. And at least then you can think, right, well, hang on, if this is going to be another 2 weeks, then I'm really going to put that routine in place. Like you spoke about how important it is to have a routine. People might think, right, actually, if I'm going to survive this for another 2 weeks or 3 weeks or longer, then I'm going to really make the effort to have that routine, to do some meditation, to regularly schedule a Zoom chat with my closest group of friends every day. You can plan quite. Whereas if you think, actually on Thursday I might be able to see my mates, then I don't think that's going to
Nah.
Sorry.
Not yet.
Not
That's
yet.
all the questions. That's everything. I think we've covered everything everyone asked.
Well done. Thank you, Julia. That was amazing.
No, thank you. You're just amazing.
Stop it. You're amazing. I think one of the things, somebody was asking how we came to know each other.
Wow.
We met this morning the first time, didn't we?